When I had sex with my girlfriend, she ejaculated a lot of liquid. Is this normal?
It may be female ejaculation, which is absolutely normal, but it also could be sexual incontinence, which is a clinical problem and needs clinical intervention. Hi, I'm Dr. Yishan, a clinical psychologist and sexologist. So I want to talk about this phenomenon of female ejaculation today. So according to a review paper published in 2013 on the Journal of Sexual Medicine, the prevalence of women to have female ejaculation is between 10 to 54%. However, for women who experience sexual incontinence, the prevalence is about 0.2% to 66%. There are also two subtypes within sexual incontinence. One is incontinence during penetration. The other is incontinence during orgasm. The ratio is about 6 to 4. So as you can see, sometimes when you have ejaculation, the time point may be different than orgasm. But I still want to emphasize, female ejaculation is absolutely normal. Some women has it, some women don't. If you never experience female ejaculation, don't worry, it's fine, it's totally normal. If you experienced it before, it's also normal. Please don't shame yourself for having or not having it. However, you have to pay attention. If the liquid is too large amount or you have other health concerns, this actually may be sexual incontinence. How to tell them apart? It's hard to tell just by looking, but there are two factors you can consider. One is how strong your pelvic floor muscle is, because some research found some women with stronger muscle contractions around the pelvic floor area, they actually could experience female ejaculation more. On the other hand, for some women who have stress urinary incontinence, that means when they laugh or cough, they may leak some urines. These women are more likely to experience sexual incontinence during sex. And the percentage could be as high as 89.4%. So you can see how strong the muscle can contract. It's closely related to how likely a woman may experience sexual incontinence. Second, if you really look into the components of these liquids women ejaculate during sex, you will see there are some difference. This is a research form in this paper. As you can see, the urine and the squirting liquid and the ejaculated liquid, the color, the components, the percentage of each components are all quite different. However, in our daily life, there's no way you're gonna collect this liquid and do some data analysis about it, right? So the best way to actually diagnose whether you have a normal female ejaculation or clinical abnormal sexual incontinence is through some clinical testing called urodynamic testing. In this test, medical doctors will check naturally how your body urinates. Also, they're gonna be purposely inject certain amount of liquid or manipulate your physical symptoms somewhat to test how your body reacts around the urinary. Then combine all this data, medical doctors will give you a formal diagnosis. Based on that, they will discuss with you about the follow-up treatment. So if you really have sexual incontinence, there are a lot of treatment available. Some people can just benefit from simple physical therapy. Some people may need to take some medications or even have some surgeries done. But based on a lot of research paper I have read, the treatment efficiency is pretty decent. A lot of women can improve dramatically after this treatment. So if you're experiencing some of these problems, first try to get a diagnosis to figure out is this normal or abnormal. And then remember, there are always resources and hope out there. Even if you have this clinical problem, you can still get it well taken care of. So what do you think about female ejaculation and sexual incontinence? Feel free to leave a message down below. Let me know. If you like my channel, please feel free to subscribe and like. You can also download a free ebook through this link. I'm Dr. Yishan. Remember, love yourself. You are special. I will see you next time. Bye. Are you struggling with insomnia? Do you know there's one method out there? It's first-line treatment in many countries. It's very evidence-based and it's very effective. And it's called CBTI. So I have designed this 4-week-long CBTI course to help you recover from insomnia without relying on medication. I provide weekly Q&A sessions to help you tailor the treatment to your own needs and your own sleep pattern. Check it out at this website, mindbodygarden.com/insomnia.